Hi, my name is Yasmin Tarehi, and this is Startup Confessionals, where we interview startup founders and entrepreneurs in the Middle East and Africa. We'll learn about some of the biggest lessons these founders discovered on their journey, from the personal to the professional, and share how they keep themselves motivated. Today's episode is with Emilian Popa, who is an African-focused investor and entrepreneur. He's the founder and CEO of ILARA Health, a high-tech point-of-care diagnostics venture which aims to democratize access to diagnostics across developing markets. Emilian has over 10 years of successful launching, fundraising, growing, exiting technology ventures in Africa, Asia, the Middle East, and Russia. And I'm so excited to welcome him to the show. So, Emilian, thanks for joining us.
Thanks, Yasmin, for having me.
So, Emilian, I want to dig into ILARA Health and why you created it. But before we talk about the why, can you briefly share what the value proposition is in your words with our audience?
Sure. At ILARA Health, we make diagnostics more affordable, accessible, and accurate in Africa. And our vision is a world in which early detection and preventative healthcare are accessible to everyone, everywhere. And the way we do this is through redefining primary care across emerging markets, starting with Africa, by bringing those novel diagnostics and digital solutions to underserved healthcare facilities and patients.
And Emilian, can you kind of walk us through the product itself? So you have a lot of different types of equipment. Are there maybe some that are used more than others? Like, can you just briefly, walk us through that?
Sure. We have, so in a nutshell, what we do at ILARA Health, we bring high-tech portable diagnostic devices to target the key health conditions that we see in the countries or in the markets where we are active. So typically in Kenya, which are diabetes, cardiac diseases, conditions such as antenatal care, pregnancy scans. So we scout the world to identify the latest innovative companies manufacturing those small portable devices. We bring them into Kenya. We test them from both functionalities, but also from an economical perspective to make sure that from a pricing, from an adaptability to the needs, they work. And then we place them through a leasing model into those small, many medical facilities, which would be the equivalent of a GP practice in the Western world. We place them on the desk of the clinicians. And we connect them with a piece of technology to be able to give the results of those at a blood test or scans through an ultrasound, give them back to the clinician and back to the patient eventually. And one important part is that those clinics cannot buy your $50,000 ultrasound, but they cannot buy the $2,000 ultrasound either because they don't have working capital, they don't have money to invest in assets. So we lease those devices over 24, 36 months to make it affordable for the clinicians to use them. So we're a mix of device company, integrator, financier, and then we also build a solution at the clinic level to, as I mentioned, to bring those results to the patient and to the clinics. So we have multiple devices. Some of them are requested or there is a clear demand in the market, and mostly for the very basic blood test or for the scans done with an ultrasound, mostly for pregnancy. Some of them do not exist historically in the markets and in the setups where we are, in the settings where we are, because of a lack of education on diagnostics on both clinician and patient sides. Actually, I just want to mention that most of those small medical centers are run by nurses, so not by doctors. So the level of education from a medical perspective is very low. So some devices are have a clear fit, immediate fit. The device is targeting the clear markers, the simple markers for diabetes or for certain cardiac conditions. But some other devices which are very, very important from a global healthcare perspective, it takes us more time to test them and to educate the market for the only importance of early detection of certain disease areas with those diagnostic devices, and eventually through prevention.
I'm really curious how you were able to launch in that market, because there's a lot of different types of, cultural nuances and complexities, language barriers. And as you were saying, there's definitely an education component to bringing everyone up to speed on how to use the diagnostic. So how did you guys build your onboarding experience, and how did you kind of build out your go-to-market when you were accounting for all these factors?
Sure. So early stage when actually ILARA, what ILARA is today is a result of not only the past 3 years since we started the company, but it's the result of me being in Africa for 12 years and being very, very passionate about healthcare, and then going into the field, even in my past career of doing venture capital, going and meeting with those many, many small, medical centers run by nurses to understand the need, to understand the people, the type of patients, to understand how the healthcare is delivered, to understand where the gap is. So really trying to transform a passion into something which can work from an economical perspective, but which can also make a massive difference, a massive change. And what I've seen is that, unlike structured, I would say, developed market where, let's say in the UK, there are probably 1,000 or so proper hospitals and clinics. In Kenya, there are 15,000, so 15 times more. But all of them are super, super small. So run by nurses who are super entrepreneurial. But each of those small medical centers, which are usually 1 room or 2 room with one person inside delivering care, make most of their revenues through selling meds. So it's kind of a small pharmacy in a room, and a nurse doing some kind of consultations, and then providing very, very basic diagnostics, mostly for infectious diseases, so HIV, malaria, syphilis, etc., TB. And when patients need more, they don't have access because there is no lab around. There is no proper laboratory as we know it from the developed part of the world. And so my initial impression was, well, there is no lab. There is a massive gap. Let's build labs. Let's bring the laboratory concept that we know from let's say South Africa or from Europe, from the US. But the challenge is that the average Kenyan spends $70 per year in healthcare. The average South African would spend $700. The average American would spend $7,000 or $10,000. So the gap is massive. And out of those $70 spent by a Kenyan on healthcare, about 70-80% is medication. The rest is a bit of procedures. So the remaining for diagnostics is very, very small. So no surprise that someone cannot pay for a simple blood test, for a simple full blood count, or for a simple, cholesterol or kidney or liver panel. So the market is complex because, number one, there is no money. Number two, there is little demand for some more complex diagnostics, but there is little demand because there is no money. So this circle where, one coming to a market like this would say initially, well, maybe there is no market. And, we've seen a lot of companies in the world avoiding certain sectors, mainly in healthcare, because in Africa, healthcare has been seen for 50 years as a non-profit sector, right? Financed through global health organizations, through NGOs, through grants. But the reality, the need is there because 15% of Kenyans or so are pre-diabetics or diabetics. 20% of Kenyan adults have high blood pressure. And, I was just reading an article recently that by 2050, we expect that 90% of Nigerians will die because diabetes and cardiac diseases. So the need of identifying diseases early enough, and I'm not even talking about cancer and other things, is there. The question is, how do we make it affordable, number one? But how do we educate the market, number two? So we started with the basics, really understanding the market, going clinic to clinic, speaking to the nurses, and bringing in the first very basic devices. Then we expanded into more clinics. And then we started to educate on those nurses with field agents. We have about 100 people now in Kenya. We go door to door. We step into the clinic and we talk to the nurse or to the doctor. And we try to understand the need, and we explain what devices we have to cover that basic diagnostics. And because we make it affordable, and because we build those partnerships, it's not just selling devices, and because we bring the data, the diagnostics data, back to the clinician, so the clinician can manage chronic conditions, chronic patients. It makes it very, very valuable. So we literally build an ecosystem which did not exist before in those areas. And we're not in the cities. We're not in the center of Nairobi or in the center of Mombasa in Kenya. We're in the outskirts, in those massive belts around the African cities where people come from the countryside. They've been coming for years and years. They build those low-income communities, which are much, much bigger than the cities itself, and where there's little or no infrastructure. And that's where we see the need, and that's where we are.
Wow. I'm so moved by that. I think, it's fascinating what you've built and also how you navigated the ecosystem, and also bringing back the data to show the nurses and to show these clinics kind of how to manage their patients, because I think that is exponentially valuable. So, Emilian, I want to talk about why you decided to start this company. I mean, you mentioned that you'd been in Africa for 12 years, that you'd been paying attention to this, this kind of culture and this land and the industry. But I'm really curious, why did you want to start this? Like, is it part of your mission? Is it part of your legacy?
It's actually a passion. My goal has been for years to live a long, healthy, and happy life. And because I've been on the continent for so many years, I've been trying for a while to find an affordable way for everyone else to do the same. And I think we are in in times where we're really living in I would say revolutionary times for healthcare, thanks to the digital health technologies, which are developing very, very fast. And I believe in this exponential growth of health technologies, and including the laboratory and the blood markers and the diagnostics. And we know that in the same way, the digital technology has provided cheaper and better phones, smaller fintech solutions which avoid banks in our days. The digital technology can help provide cheaper, faster, and more effective solutions for prevention, for disease prevention, for detection and management, and this will eventually transform, the whole healthcare systems into from unsustainable systems the way we see it in the developed world, where healthcare is so expensive, and US is a good example of the cost of healthcare, and I think this is going to change into a sustainable system thanks to the technology, and I've been so deep into this prevention, detection for myself and for people around me, and again, this comes from family issues, friends issues who either got very sick and some unfortunately passed away because of things which could have been prevented if detected earlier, or treated if detected earlier. Be looking at how to bring this to people who unfortunately cannot afford what I can afford to see doctors and doing 30-40 blood tests a year and try to see what's wrong with me. And that was at the origin of what ILARA is today.
Wow. And so I want to talk about the financing stage, because that's something I think a lot of people are really interested in. How do you go about starting a company, and what does it take, in terms of bootstrapping in the beginning? Can you walk us through your financing journey and what led to your round of funding, and then also how your priorities have shifted based on the company moving into a new fundraising round? Like, how did you kind of shift your orientation about how to operate?
Sure. So we like many companies. I started this company with it was self-funded. So I built a first pilot with one test, and this was diabetes in few clinics around Nairobi. This was in 4 or 5 clinics back in the beginning of 2019, and then the goal was to show that this pilot works. And then I went out to raise our seed funding. And then I introduced 4 diagnostics to cover the biggest needs. So diabetes markers, cardiac markers, pregnancy, so antenatal scans, and hematology. And those are the key. And with the seed round that we raised, we managed to not only introduce or for diagnostics, but also to grow to, I think was 40, 50 clinics at a time. And then, so I showed that this model works, at a small scale. And then we went to raise the Series A and added more diagnostic devices. And we started to integrate them to be able to bring all those markers into one place and eventually offer them to the doctor on a tablet. And that's where the Series A helped us expanding into the close to 400 clinics today. But also, we knew from the very beginning that just placing diagnostic devices is not enough. In a market where there is very little money spent on diagnostics. So diagnostics for us has been always the beginning, and we always say, diagnostic is just a beginning. At that time, we didn't exactly know what else can we bring there. But we realized over time, by spending time with the clients, that one needs to be able to monitor chronic patients. So then we decided to build a very basic patient management platform. And now we're preparing for our next round, our Series B. And as we understand much better the needs of a small nurse-led medical practice, we also realize that their biggest need alongside, so they always tell us, I want to have a lab in my medical facility. But the reality that they also need financing. They don't have access to financing. They need working capital to buy more meds, to build more beds, to increase the capacity of their medical practice. So we're really working now on a basic step-by-step, I would say module-by-module operating system for those practices, starting with billing, continuing with the expense side, to be able to understand the financial flows into those small, let's call them medical merchants, because in reality, they're all small entrepreneurs, SMEs. For them to be able to, for us to be able to provide this data to potential financiers, which are today shy to cover the sector because there's very little visibility on the financial flows of those nurse practices. So that's kind of how the step-by-step we've been building from a pilot into the various funding rounds. And now we position ourselves for the next round to show not only scalability of the diagnostics model, but scalability of something much bigger than just diagnostics.
Oh, that's exciting. Can you share a little bit about what's next on the product roadmap, or are you just going to wait until it's announced?
No, so really the roadmap is going into thinking, how do we build this operating system? But this very basic operating system to capture the financial flows and operational flows of those small medical facilities. Today, one of those small clinics makes, let's say, $5,000 a month, and then they make a profit. There's the reason they are there. There's the reason there are 7,500 out of the 15,000 private facilities, because every nurse who wants to make a bit more money will go and then open a small clinic next to another one, and you end up with this many. They're all, most of them are profitable, but they make a small living. They can't grow because they don't have money to grow, as I mentioned earlier. So why they don't have money? Because no one can finance them, because no one knows, their P&L. No one knows how much money do they bill the clients. And most of those medical expenses are out of pocket, by the way, for the patients. So it's really getting into an operating system while also collecting medical data, which insurance companies or other payers are interested into. So we really try to bring partners in those medical facilities. On the payer side, the only 2.5% people insured in 2.5% of people insured in Kenya, for example, and Kenya is one of the biggest insured countries in Africa after South Africa. So bring insurance, but insurance cannot come in because they don't know anything about the patients. They can't price their policies, and also bring financiers for the working capital and the assets of that small clinic. So that's really the system behind this that we're building currently.
Wow. So how has the COVID crisis impacted your business over the last year? Has there been any major shift?
Look, like everywhere in the world, that's what we've seen, when COVID started, right? Patients stayed home. Patients didn't go anymore to the GPs, and we've seen this in the US, we've seen this in Europe. Obviously, COVID patients went to hospitals, but all the kind of the primary and secondary care has suffered a lot. So obviously, we are a B2B company today. So we place diagnostic devices in a small clinic. If that clinic doesn't have patients anymore, they can't pay for it. They can't pay back the leasing fee. So it was a bit challenging in the beginning, but also I think COVID brought such a long-awaited awareness around healthcare in emerging markets and healthcare in general. But in our markets, it brought awareness around the fact that healthcare is not just about HIV and malaria. Healthcare is about people. More people die from diabetes and cardiac diseases than they die from malaria, infectious diseases, and COVID actually, right? So we've seen actually there were a couple of months where our clinics didn't have enough revenue to pay us, but those entrepreneurs are very resilient. They managed to actually turn around and then brought back patients, and healthcare is very very much about life or death. So people went back, and then clinics started to make revenue, and then the market went back to the pre-COVID stage in healthcare, at least after a couple of months.
Wow. Can you tell us a little bit about, obviously this is one challenge, but I'm sure that as a entrepreneur and as a founder, and especially, in this type of a market, you have faced numerous challenges. I think it's important to discuss not just the kind of wins that, take place when starting a company, and the successes that I think are so obvious and apparent. I think it's important to also talk about what happens behind the scenes. How do you deal with adversity? How do you deal with challenges that come up? How do you stay motivated when things are tough? I'm wondering if you could speak to that and, how you've dealt with that as an entrepreneur for so long.
Actually, the biggest challenge to date in ILARA hasn't been operational, but it's been the team. And we know that a lot of startups fail not because of the market or the product, but because of the team, and not because of the financing, but because of the misalignments in the team. So late 2019, after a number of months of misalignment with the core team on what type of company we wanted to build, I had to make the tough decision to rebuild the whole management team at the time. And it was a very small management co-founding team. And the thing we came out stronger from that team crisis and ended up rebuilding the core with people who are really aligned on the mission and vision of ILARA, around making early detection and preventative healthcare accessible through redefining this primary care in Africa by bringing novel diagnostics and digital solutions to those underserved communities. So team is super important, and that's where I saw this issue as an entrepreneur in the past, not at that level. I saw it as an investor in companies which failed because of misalignments between the founders and in the management team, but as the first time where I saw it so strongly in my own company.
Yeah, I think, it's amazing. It takes a lot of maturity and, just takes a lot of, I guess, confidence to be able to kind of point out what's not working and also what just needs to be revised, because every stage of a company is very different, and what a company needs is going to dramatically shift over the course of its life cycle. So I just think that that's wonderful that you made that decision, because alignment on mission is incredibly important. I've seen that too in my tenure.
Exactly, and look, motivation. You asked me what continues to motivate me. Actually, my passion for what I do is so deep, and that's literally part of my life, which I think is very very important when you build a business. It's not just a business; it's actually a life. And my passion for Africa and for delivering better care to those communities is so strong that I think this is what has made also a massive difference. And look, we're still growing. I think the future will say if what we're building here is going to be massive or not, but at least we're making a massive difference. And my goal is to make a difference, but also to bring value to our investors and our stakeholders. So that's something which keeps me up overnight.
Yes, yeah. Yeah, it's interesting. I've been, thinking a lot about the idea of like, societal worth, like what does society think a company, a product, a person is worth? And I think the impact that you have had on the communities in Africa is just so massive. So, I mean, that alone, regardless of other financial implications, I mean, I think that alone is incredible. Emilian, I want to talk a little bit about some books that have inspired you on this path. I think it's really interesting to peek behind the curtain and take a look at the bookcases of founders and just kind of get a sense of what has inspired them, what's stayed with them. And so I'm just curious, it could be a book, in the industry of healthcare, or it could just be a book on startup, being a founder and what that's like, or it could just be like a completely, different book on fiction that may have inspired you from a different perspective. So I just love to open the door and ask that question: what book or books have inspired you the most on your path?
Sure. I mean, that's a great question. I actually read one book a week, or I'd rather listen to one book a week. So my goal, it's my goal this year is to get to over 60 books. I'm about 40 for now, so I hope I'm going to reach it. So I read a lot of healthcare or longevity or age related or anti-aging books. But I actually read a really interesting book. It was my book last week, and it's a book called Out Innovate by Alex Lazarov. And this book actually it compares the frontier market entrepreneurs with the Silicon Valley entrepreneurs, and kind of the conclusion is that the frontier market entrepreneurs, unlike the Silicon Valley entrepreneurs, need to build a full stack of companies. So it's not just and this goes back to ILARA, we're not just a diagnostics company. We started with diagnostics, but we need to build the full stack. We acquiring the devices, bring it to Africa, test them, install them, lease them. So we finance them, we integrate them, we build a platform for the clinics. We think of deeper than just diagnostics, because there is no ecosystems in those markets. In frontier and emerging markets, there's no other companies doing the other parts of the ecosystem. So one needs to actually, a frontier market entrepreneur needs to build this ecosystem. And also, we need to think profitability. So the other learning from the book is we need to think profitability immediately, because it's not just growth at any price, because there's not that much funding available as in the Valley or in more developed parts of the world. And I think the third thing that I took out of this book is we need to think global immediately. The markets where we are, the individual markets may be too small, for one thing. And that's exactly what we see in Kenya. Kenya, it's a 45, 50 million people, but is too small for just a couple of diagnostics. So one is to either think multi-product, full stack to cover one market, or take that product, from early stage into other markets. And I'm actually now in South Africa because we're launching ILARA Health in South Africa in a slightly more mature market. So that's really, really good book, and I would recommend it to have whoever is interested by this topic.
And the book is called Out Innovate by Alex.
Out Innovate, by Alex Lazarov.
Okay, perfect. So we're going to wrap up, but I wanted to ask you one last question, Emilian. I wanted to know what has surprised you the most while you've been on this path.
I think, even if I knew that the team, and I got to go back to kind of the team thing, even if I knew the team is number one thing, and I've seen it again as an investor, as an entrepreneur before, I was taken by surprise by this early misalignment in vision and mission in the early management team. And also, I think on the positive side, I was actually surprised of this resilience during COVID, resilience of our clients, small medical businesses, to these market downturns. And there will be other downturns. But what I've seen in Africa and in our clients is one thing, but I've seen it over and over again in other entrepreneurs, in other smallest, in other SMEs, is this massive, massive resilience. People are there, and whatever happens, they turn around and they build amazing, amazing businesses to feed their families, but also to provide, better quality of services to their clients.
That's amazing. It's very inspiring, the resiliency of humans. I love that. Oh, thank you so much for your time, Emilian. I learned a lot. And where can people find you? Are there any resources you can point folks to? What's the website for ILARA Health? Is it just ilarahealth.com?
Yeah, it's ilarahealth.com. I'm actually, I will have a website soon. Actually, next week, I'm launching, I'm putting live emilianpopa.com, which is going to be more like a blog about my motivation, the books I read, the things I invest into as an investor, because I also invest, in fellow entrepreneurs on the continent. So this is going to go live next week. Otherwise, on LinkedIn, I'm posting different views, and so yeah.
Amazing. Okay, well, we'll include those all in the show notes. Thank you so much for your time.
Thank you so much, Yasmin.
Thank you. And for our audience, thanks for joining and for listening to Startup Confessionals.